Hi, everyone. Dr. Adriana Popescu here with another installment in the Ask Dr. Adriana series, where I like to talk about different issues related to mental health, therapy, healing, and anything else that my audience suggests. So I'm always open for suggestions. If you want me to talk on a certain topic, please let me know either in the comments here, or you can always DM me on whatever social media you're catching this on. These days we're all over the place. So what I wanted to say is, how do I know if therapy is working? Okay, sometimes this is a question that clients may ask. And I mean, the simplest answer is when you notice you start to feel different, right? Eventually, we want you to be feeling better, but sometimes it starts with just feeling different. One of the things that I often, work with people on is trauma, for example, or I'll work a lot with folks on their limiting beliefs, things that they have come to believe from a very young age, and that really, got solidified for them. Things like I'm not worthy, I'm not enough, I'm a bad person, things like that. And I would love to say that in one or two therapy sessions, we could magically change all that, a lifetime's worth of trauma, to clear a lifetime's worth of trauma, or to clear, a long-standing core false belief, because I don't actually believe those things to be true. We're not born with those beliefs. But to undo all of that learning and programming, it sometimes takes a while. It can take a number of sessions. And it also depends on the work that a client does in between sessions. So I really like to give my clients a lot of tools. I give them tools that will change the energy around things. I give them tools to manage their anxiety and stress when they get triggered with their trauma responses, which can look like that fight, flight, freeze response getting activated. I teach people how to do those things in sessions. And then the people who will work with those tools outside of the sessions in real time, when they're getting triggered in their lives, driving down the road, or in a meeting with someone, or at home with their partner or kids or whatever, those are the moments when you're usually getting triggered with this stuff. And you need to be practicing the tools in the moment to really start chipping away at them. Oh, hello, everyone who's tuning in. Hi, Adele. Hi, Ibdetal. I don't know if I'm pronouncing your name correctly. I apologize. And thanks for checking in and tuning in. If you guys have questions or comments, let me know. I can see them in real time here. But how do I know if therapy is working? I mean, usually with my sessions, because I have a more holistic approach. Those of you who know me know that I don't just do traditional talk therapy. To me, traditional talk therapy is a little bit like a dog chasing its tails. You can kind of go in circles. You can get into what I like to joke about is mental masturbation, where you're just talking and talking and talking about something, but not really changing the energy, of those words, of those traumas, of the things that you're thinking and saying and feeling, right? Because thoughts, emotions, sensations in your body, they're all energy. And the thing is, particularly when we're talking about trauma, energies can get stuck in our bodies. And belief systems are energies that get stuck in our consciousness. And so my experience in over 25 years has been that we have to take a more holistic approach to these things. We have to look at an issue that someone is going to come to in therapy, like depression, anxiety, just stress, PTSD, addiction. You have to look at that issue from the physical, mental, emotional, and spiritual aspects. And you have to address the things in each of those areas that is contributing to the person having a problem there. For example, with addiction, you might be physically dependent on, let's say we're talking drugs and alcohol, you might be physically dependent. There might be a chemical imbalance of some sort. Your body systems, your liver, might not be working properly. Your neurotransmitters, when you are depressed, might not be in the correct balance. So you might need things like medications to assist you, or you might need to get a checkup at the doctor and see if what you have is really depression, or is it maybe a thyroid imbalance? Is it that you don't have enough vitamin D in your system? So we always need to include the body in this. I often will have my clients go and get blood work or something done to see if what they are experiencing might have a physical basis to it. Of course, mentally, we're dealing with thoughts, belief systems, thought distortions, memories of things, emotions, and often we're dealing with spiritual issues. Hi, TJ, good to see you. And often we're dealing, TJ knows all about this, in his conscious recovery work, we talk a lot about the spiritual components of addiction and recovery and how oftentimes we're not addressing that aspect of it. Again, using the example of addiction, oftentimes people have a deep, deep shame, about themselves. They think there's something fundamentally wrong or defective with them. And that's part of the reason why they might be trying to numb a sense of toxic shame with drugs and alcohol. So we need to look at that aspect as well. A lot of people feel, especially if you're depressed, you might be having some existential, spiritual questions about why am I here? Or maybe my life doesn't feel like it has much meaning and purpose. So to me, to really be successful in therapy, you have to be addressing all four of those aspects: the physical, mental, emotional, and spiritual. And if you're not, as a therapist, I think you're doing your clients a disservice. The thread that, and I want to say a little bit more about that in regards to trauma specifically. But then let's also look at like the common thread that runs through those aspects: physical, mental, emotional, and spiritual. Well, it's energy, right? This is why I love working with energy psychology or access consciousness or any other kind of modality, NET, neuroemotional technique, tapping, all these different tools that I use, because they help us to shift the energy of those thoughts, those emotions, those traumas that are locked in the body. And talk therapy just can't really get there. Talk therapy is a little bit like the tip of the iceberg. And then underneath the surface, there's this like giant iceberg that has way more layers than just what you see on the surface. I think we need to be addressing all of that as healers, as therapists, in order to really help our clients to heal. And nowadays, what we know specifically about trauma is that trauma does get stored in the body. It has long-lasting effects on your brain, even on your genetics. This whole field of epigenetics is now telling us that trauma can change the way your genes function, or being under highly stressful situations. The Adverse Childhood Experiences Study, this came out in the 90s here in Northern California. It was a study done with Kaiser Permanente patients. It's a healthcare system we have here. And they looked at over 17,000 people, and they correlated their physical and mental health later in life with early adverse experiences they would have had in childhood, like, experiencing abuse or neglect, or having a parent or caregiver in the home who has an addiction issue or a mental health issue, or somebody was in prison or jail, or somebody, there was a witnessing of domestic violence. All of those things have a profound impact on a child's developing brain. It can change the way their amygdala functions. The amygdala is very involved in that fight, flight, freeze response. And in the study, what they found is the more adverse childhood experiences people had, the more likely they were later in life to have mental health issues, addictions, and all kinds of other physical health issues like heart disease, cancers, lung disease, all these different issues. So the reality is that our life experiences shape us physically, mentally, emotionally, and spiritually. So if we want to heal from them, we've got to be looking through all of those lenses. And particularly when treating trauma, it's really become a specialty niche in therapy. I would say, the average therapist is not learning the most what are coming to be the most evidence-based practices or best practices when it comes to treating trauma. Just telling your trauma story over and over again isn't going to heal it. If anything, it's going to re-traumatize you. It's going to reactivate that fight, flight, freeze response. You're going to start having, flashbacks and memories, intrusive thoughts. You could have emotional flooding. You could have any number of things come up as trauma after effects, conditioned trauma responses that just can't be extinguished with words alone, with just talking about it, telling your story. The research, I think, is coming out to start to back that. The really interesting research we're getting into nowadays is brain scans. We're doing fMRIs. We can do EEGs where we measure brain waves. We can look at people's brains who, let's say, people. Here's a great study. We should put a link in this, in the comments. There's a TED Talk that Dr. Peta Stapleton, Peta Stapleton. She's a researcher out of Australia, who works with energy psychology. And she did a brilliant study where she looked at people with food addiction, people who are often overweight, they have food addiction issues. And they did this very clever study where they put people in an MRI machine, show them photographs of their favorite comfort foods, the things that they, find themselves binging on, and looked at what parts of their brain lit up when they were looking at those photos. And then they sent them away. For 4 weeks, they had them tapping on acupuncture points while thinking about those foods and the cravings, when they would have the food cravings. And then 2 hours a week, EFT tapping they did for 4 weeks. And then they put the people back in the MRI machine and looked at their brains again, showing them those photographs. And guess what? After 4 weeks of tapping, the brain changed. You could see the changes in the brain where people were no longer having that, especially the addictive parts of the brain. This is like the amygdala, the nucleus accumbens, the anterior cingulate, whatever, all these different brain structures. Those parts of the brain get lit up when somebody is thinking about engaging in that addictive behavior. Well, after the 4 weeks of tapping, those parts of the brain no longer lit up. And when they did follow-up studies, a year later, they found that the results were maintained. So that to me is saying you are creating changes in the neural pathways of the brain. You're creating changes in how the brain is functioning. The research on access bars, for example, is a hands-on energy process where you're touching these 32 different points on the head. The research on that, what they can see is people's brain waves. When they look at EEGs of the brain before and after receiving a session of access bars, they can see changes. They can see that brain waves slow down. They get more you have more theta, which is that state of deep relaxation or meditation or hypnosis. You see more theta brain waves. You see more coherence where the different parts of the brain are communicating with each other in healthier ways. And you see lasting results from that. As self-reports, people feel less stress. They feel less depression. They feel less anxiety from an hour of having energy work done on their head. To me, these are the innovative technologies and therapies that we as a field in psychology should be moving towards. If you work with trauma, I think you probably also need a tool like EMDR or brain spotting. I prefer brain spotting. I find EMDR to be oftentimes a bit too overwhelming or flooding for clients. And so this is where sometimes people get stuck with, is therapy working for me? Because you could have an experience, you could have maybe a negative experience, let's say working with trauma, where you're doing an EMDR session and it's because you're opening up all this unresolved trauma that's been locked in your body. Sometimes it can feel a little overwhelming. Sometimes you might feel worse before you feel better. And I think it's important for people to understand that. Like, I love for people to walk out of my therapy sessions feeling like, yeah, something changed, or I feel hope. That's another way therapy is working, when you start feeling hope again, or you start feeling connected more to your authentic kind of essential self. Like, we get disconnected from ourselves so easily, especially with trauma. Or think about this pandemic, I don't think we've come back to where we were pre-pandemic. There's a lot of people still feeling lost, feeling really depressed or disconnected from themselves, or really in this question of like, what is the point of it all, or what meaning and purpose does my life have? And so when you are feeling disconnected in that way, when you feel hopeless, maybe when you feel depressed or you feel overwhelmed, you're disconnected from your strengths. You're disconnected from your essence, that what I like to call your infinite being, your spirit, that is infinite. And that goes beyond whatever current life stressors you're having. We get cut off from that. And so I think part of what we're doing in therapy is also helping people to reconnect with that, with their innate strengths. And we're empowering people, right? That's the other piece. I think good therapy empowers people. It helps them to connect with their strengths. It helps them to challenge core false beliefs and other kinds of cognitive distortions that we're often functioning from. It helps us change our point of view so we can see things differently and create change. The power of question is enormous. TJ talks about it a lot in conscious recovery. We talk about it a lot in access consciousness, and the power of living in the question or as the question. Because when you use questions in therapy, they open up possibilities. Answers and conclusions and trying to figure it all out tends to actually stop the flow of energy and create restrictions and limited possibilities. So I really like to use questions a lot in therapy. What would it be like if? What else is possible here? How does it get any better than this? What would it take for blank to show up? This is activating the law of attraction or ask and receive. Like, that's a real thing. It really does work. But people don't know how to apply that. So I like to teach people how to use the law of ask and receive to work for their advantage so they can be more conscious about what it is that they're asking for. And then we can remove whatever barriers that are usually limited to those core false beliefs, those limiting points of view that don't allow us to actually receive what it is that we're asking for. So I think what I'm saying in this conversation is there's a lot more to it than there's just sitting there, as a therapist, nodding your head. Tell me more about that. And how did that make you feel? That sounds like it was really difficult. This is kind of traditional talk therapy. It's what most of us learned in grad school. Sorry to say, I don't find that to be super effective. And I think that, like I say, we need to be covering things holistically. We need to be looking at the mental, emotional, spiritual, and physical aspects of a condition. We need tools that cover all of those areas. We may need to work collaboratively as a team with other healthcare practitioners, like a psychiatrist or a primary care doctor, other kinds of healers a client might be working with. I often send my clients to a good friend of mine, Michelle Watkins, who was in grad school with me. And she was also a guest on my podcast, Kaleidoscope of Possibilities, where we do explore these alternative perspectives and healing modalities for mental health. And, Michelle does energy work. She does Reiki. She does shamanic work. And sometimes I find that is super helpful for my clients, especially when we're working with a deeply entrenched issue that hasn't had a lot of change. A lot of clients come to me and say, I've been in therapy for 10 years and this trauma thing or this other issue really hasn't changed. So I think especially when we're dealing with these more deeply entrenched issues and the conventional methods haven't worked, that's especially when we need to go outside the box and be looking at, okay, what else is possible here? What has not been, what stone has not been uncovered here? Where have we maybe not gone deep enough into unresolved stuff from the past? Sometimes I might be doing work with folks from other lifetimes, if that's in their worldview, if that's part of their belief system. We might need to be doing work in the spiritual. This is why the psychedelic assisted therapy is this huge resurgence right now in the world. Where initially it was researched back in the 1960s, and then politics and laws came in and cut that off. But, in the last few years, we've had a huge resurgence in the research. There's a tremendous amount of data that's telling us this stuff works to help people with depression, with end of life stuff, with grief, with trauma and PTSD, even with addictions. There's a growing body of evidence supporting psychedelic assisted therapies. And there's other techniques too. They're doing magnetic stimulation of brains, TMS. There's so many different, more holistic, more outside the box therapies that are out there. And I just think it's super important to educate, our fellow mental health professionals, as well as the consumer, the client, shop around, find a therapist. That's the other thing too, is I hear a lot of clients, when they come to me, they'll say, yeah, I was working with this person for a while, but I didn't really feel like the connection was right, or I didn't really feel like the things they would say to me didn't feel right. It made me feel bad about myself sometimes, or I felt judged by my therapist, or like I couldn't tell my therapist what was really going on. I mean, if that is happening in the relationship, one of the things that the research shows is like one of the top things that makes therapy successful. Like the number one thing is your own motivation and your intention and doing the work, right? And then number two is the relationship that you have with your practitioner. So if you don't feel safe enough to really open up and be honest with your therapist, if you feel judged by your therapist, if it just doesn't feel like the right fit, it's like staying in a relationship that like is unhealthy. Well, why would you want to do that to yourself? So if it isn't a good fit, get another therapist, shop around. Most of us are offering free 30-minute sessions. I do that. I even have it automated now on Firebird Healing on our trauma healing program website. You know, it's like you can just set up a free consultation. Let's have a meet and greet. Let's talk about what you're wanting to work on. What's helped you. I love asking clients, what has helped you in the past? What has not been helpful to you with therapy? And then let's see if working together would be a good fit. Are you open to trying some different modalities that are maybe different than what you're used to? You know, are you open to this idea that energy work might be helpful to your situation? So all of those things are really important factors to consider with therapy. And how you'll know, and especially I think if you're using some of these techniques, one of the things I've found in working with folks is that when I bring in the holistic techniques, I get change a lot faster than the traditional stuff. And the research is backing that. If you go to energypsych.org and you go under the research tab, this is the web page for the Association for Comprehensive Energy Psychology. If you check that out, you'll find that when they compare energy psychology techniques like EFT tapping to standard Western psychological techniques like cognitive behavioral therapy, both can be effective, both can get good results, but usually the energy psychology results happen in about half the time. So I don't know about you, but I'm somebody who's pretty impatient. Even though I've worked on that a lot, I'm still pretty impatient. And I personally like to change things in my own life as quickly as I can. So I want the tools that are most effective to do that. And that's what I find with energy psychology and with access consciousness. Those have been the fastest ways I've been able to change things in my own life and in my body, including my long history with Lyme disease, as I've spoken about before. It's these modalities that help me heal from it. Even Western medicine alone, Western psychology alone was not enough. I had to seek traditional therapies, you know, acupuncture, things, chakra work, things that have been around for 5,000 years. It's not like this stuff is like new and weird and woo-woo and out there. It's been around for traditional Chinese medicine and Indian medicine have been around for 5,000 years or more. I would call that evidence-based, even though there might not be a research study that the American Psychological Association has given their stamp of approval to. Nonetheless, if we know based on 5,000 years of history that there's something to this, and now there is a growing body of research that's starting to support it, I think we're doing our clients a disservice if we don't learn some of these strategies and give them to our clients, particularly emotional self-regulation strategies that help a person, polyvagal exercises, learning about polyvagal theory, educating your clients about it so that you can help them get out of a fight, flight, freeze response. Because the majority of what's happening with anxiety and stress is that amygdala in the brain is misfiring and launching a full-blown fight, flight, freeze survival mechanism that's designed to protect us should we encounter a tiger in the woods or wherever on the savannas. The reality is most of us are not encountering tigers on a daily basis, but we're having that same reaction to, oh my God, you know, I missed the train, or I'm stuck in traffic, or I'm having an argument with my partner about money or this or that. These are not really life or death situations, and our brains shouldn't be activating to a dire life or death situation response. So we as therapists, if we're working with those issues, we need to have tools that help people calm their nervous system down. So I think we need to learn those things. Eventually, I'm going to be probably moving into more and more training. I've been speaking at more conferences, presenting some of this material. I've written an article in, you know, the Energy Psychology Journal about my work at the rehab with energy psychology. I have a second book, you know, the first book, What If You're Not As Effed Up As You Think You Are, which recently came out as an ebook and soon will be coming out as an audiobook. I talk about all these different holistic approaches and how we can use them specifically toward changing these core false beliefs, which I think are at the root of like anything that's not working. It's because you have some distorted sense of yourself being not enough, or bad things always happen to me, some sort of point of view that's limiting your ability to create whatever it is you're wanting to create. The whole book is about that. The second book I'm working on now is EFT for addiction. So, I'm really trying to get out there. We recorded last year a workshop on how to use tapping in the mental health healing professions. That'll be coming out on Wholehearted probably later this year, hopefully the fall. So I really want to be that resource for you guys, whether you're a client or a loved one of someone who is struggling with whatever mental health condition. If you are another type of healing practitioner, if you are a mental health practitioner, I want to be a resource. I've been exploring these technologies and techniques for over 20 years. I've become quite expert at some of them. And now it's time to start getting that information out there, doing more trainings. I love Be Set Free Fast. I think there's so much more we could be doing with that particular modality. And I would love to present more and do some CE stuff. My publishers, Wholehearted, they are CE providers for drug and alcohol counselors and marriage and family therapists. Board of Psychology, we got to work on that one, but I am looking at more CE opportunities so that fellow practitioners can find out more. So if you want to stay on top of what is Dr. Adriana up to, because she's always up to a lot, you can follow me on all the different social media platforms. And you can also, I have 2 different websites. My personal one is adrianapopescu.org. And we have the Trauma Healing Center, firebird-healing.com. You can sign up to get on the newsletter and stay on top of all these things I'm putting out there. And if there's any topic, like I said in the beginning, that you want to find out more about, that you'd like me here to, you'd like to hear me speak more on, please do add that in the comments or DM me, and I'm happy to say whatever I can on that topic. I really appreciate all of you who support me in my work, and everyone who bought the book. We were able to make it an Amazon bestseller, new release, which was really exciting. And thank you for being there and for listening and being willing to try something different, because I hope, if in nothing else, this conversation has given you the awareness that anything in your life that isn't working, it is possible to change it. You might need to do a little work. It might not feel so great at first, but eventually you will get to that light at the end of the tunnel. Just never give up. Okay. Thank you, friends. See you next time.